causes and risk factors for heart valve disease. Anytime a person has something wrong with their heart, it's scary. Our heart is such a powerful organ, one that seems to sit at the center of our well-being and functioning. Unfortunately, it's also quite fragile. People are often born with heart problems, but they can also develop them over time, or in rare cases, develop them seemingly out of nowhere. One condition that islands somewhat common and often treatable is heart valve disease. To learn more about this condition, let's take a look at the causes and risk factors of heart valve disease. 1. What is heart valve disease? Heart valve disease is when one or more of a person's heart valves aren't working properly. Your heart has 4 valves that keep blood flowing in the correct direction. In some cases, one or more of the valves don't open or close properly, writes the Mayo Clinic. This can cause the blood flow through your heart to your body to be disrupted. While it sounds serious, there are many people who have it to a varying degree and don't even realize it. Whether or not they need treatment depends on the severity of the issue, the type of valve disease, which valves is affected, and their symptoms. The source notes that treatment can include either medication or even surgery to repair or replace the valve. Causes 2. Congenital valve disease. Oftentimes when a condition is congenital, that means it developed before birth. In the case of congenital valve disease, the issue is usually localized to the aortic or pulmonic valve. Congenital valve disease is often caused by valves that are the wrong size, have malformed leaflets, or have leaflets that are not attached correctly. 3. Bicuspid aortic valve disease. Bicuspid aortic valve disease is a congenital valve disease that only affects the aortic valve, says WebMD. People with this condition will have only 2 leaflets or cusps on their bicuspid aortic valve instead of 3. Missing even just one of these leaflets can cause the valve to malfunction, become stiff and be unable to either open and close properly, or not be able to close tightly enough, resulting in leakage. 4. Rheumatic fever. Acquired valve disease is different from congenital valve disease because the patient is not born with the problem, but rather a problem develops due to other circumstances. One of these circumstances is rheumatic fever. This type of fever is a bacterial infection, often strep throat, that was left untreated, says WebMD. Thankfully, as a result of antibiotics, this infection isn't as common as it once was, and those who do get it are often treated before it develops into rheumatic fever. The initial infection usually occurs in children and causes inflammation of the heart valves, writes the source. However, symptoms associated with the inflammation may not be seen until 20 to 40 years later. The National Heart, Lung, and Blood Institute, NIH, notes that heart valve disease caused by rheumatic fever is not commonly seen, and when it is, it's often seen in older adults who developed strep before the antibiotics were available. It's also present in developing countries where rheumatic fever is more common. 5. Endocarditis. Endocarditis is caused by germs that enter into the bloodstream and are carried into the heart. Once they reach the heart, they can infect the inner surface of the heart, including the valves, says NIH. This condition is extremely rare, but when it does happen, it's referred to as infective endocarditis. So how do germs enter into the bloodstream in the first place? The source explains that this can happen through needles, syringes, or other medical devices that break the skin and gums. Often, the body's defenses fight off the germs and no infection occurs. Sometimes these defenses fail, which leads to infective endocarditis. If someone who already suffers from heart valve disease then develops endocarditis, it will often make their condition even worse. Infective endocarditis can develop in people who already have abnormal blood flow through a heart valve as the result of congenital or acquired heart valve disease, writes the source. The abnormal blood flow causes blood clots to form on the surface of the valve. This makes it easier for germs to attach themselves to the infected valve. 6. Changes that can occur. According to WebMD, there are some changes that can occur to the heart. The chordae tendineae or papillary muscles can stretch or tear, the annulus of the valve can dilate, become wide, or the valve leaflets can become fibrotic, stiff, and calcified, explains the source. 7. Mitral valve prolapse. Mitral valve prolapse affects about 1 to 2% of the population, making it a common condition. It occurs when the leaflets of the mitral valve flop back into the left atrium during the heart's contraction, writes WebMD. This results in stretchy tissue that result in a leaky valve. Since the condition doesn't cause any symptoms, it rarely ever requires any treatment. 8. Other causes. In addition to the causes we've already mentioned, there are a few other conditions that have been linked to heart valve disease. The National Heart, Lung, and Blood Institute, NIH, states that heart valve disease can be caused by autoimmune disorders like lupus, which can affect the aortic and mitral valves. It can also be caused by carcinoid syndrome, which causes tumors to develop in the digestive tract. These tumors can then spread to the liver or lymph nodes, affecting the tricuspid and pulmonary valves. Marfan syndrome can cause connective tissue disorders, and metabolic disorders like Fabry disease or high blood cholesterol can all affect the heart valves. Some diet medicines have been linked to heart valve disease, but can be reversed once the medicine is stopped. Lastly, radiation therapy used on the chest to treat cancer can lead to heart valve disease, but the symptoms might not show up until many years later, says NIH. Risk factors. 9. Age. The biggest risk factor for heart valve disease is age. It is more common in older adults. While our improved health and medical care is a good thing because it allows people to live a longer and healthier life, it also has resulted in more cases of heart valve disease. As we age, our heart valves can become lined with calcium deposits that cause the valve flaps to thicken and become stiffer, says the American Heart Association. 10. People who have been diagnosed with. Another common risk factor of heart valve disease are people who have been predisposed or already diagnosed with other heart conditions like a heart murmur, a defect in their bicuspid aortic valve, mitral valve prolapse, or any mild form of valve disease, says the American Heart Association. Anyone who has been diagnosed with any of these conditions should regularly check in with their doctor to make sure that their condition doesn't become any worse. They should also keep a close eye on any of their symptoms in case they become worse, warns the source. If surgery is needed to repair or replace a valve, antibiotics might be needed before dental procedures to help protect against endocarditis, writes the source. You will need to discuss any potential risk factors with your doctor. 11. Born with two flaps on aortic valve. As we previously mentioned in this article, some people are born with heart issues. One common issue in particular is that the aortic valve has two flaps instead of three, writes NIH. Sometimes an aortic valve may have three flaps, but two flaps are fused together and act as one flap. This condition is known as bicuspid or bicommisural aortic valve. People who have this congenital condition are more likely to develop aortic heart valve disease. 12. Be aware of these changes. As we age, we tend to experience some growing pains that are often related to getting older, like fatigue, reduced energy, and common aches and pains. While these aren't unheard of and generally nothing too serious to worry about, sometimes they can be related to another underlying health condition. It's important to be aware of any changes that seem unusual, particularly as we get older. We need to pay close attention to our body. When the heart fails to pump enough oxygen-rich blood to the body, symptoms may appear, says the American Heart Association. Problems like fatigue, shortness of breath, chest pain, or discomfort and lightheadedness can indicate treatable problems related to the heart.